Hi, good morning. My name is Johan van Zyl, and if you're new to my channel, welcome here, and welcome to my current subscribers and all the visionaries that might be interested in actually subscribing, because I see my videos are watched quite a lot of times. Yes, please subscribe, especially if you are looking to maintain your vision, and our channel is focused on being practical solutions for complicated issues very often. And today we will be talking about undiagnosed hyperopia, or maybe if you are short-sighted, overcorrection, too strong glasses if you are short-sighted. And what does this basically mean? It means that if your child, even if he sees 20/20 or 6/6 with undiagnosed hyperopia, it does not mean that there might not be serious vision issues either at present, already existing, or coming in the future. So basically, testing an undiagnosed hyperope, and especially if the prescription isn't totally correct, can lead to sometimes very serious visual complications, learning disabilities, and there is a relationship between undiagnosed hyperopia, and we find more boys that have this problem, and ADHD, learning problems, and all of those issues with concentration. And let's talk about why this happens and what you can do as a parent to actually test for this and resolve these issues. Hi, and welcome back again. And today we will be talking about undiagnosed hyperopia, long-sightedness basically. Now, what does this mean? What does long-sighted mean? It means that normally your child can see like a hawk far away. It means that normally when he goes to the optometrist, he can see the reading chart, the smallest line of letters with no problem at all. However, it does not mean that there's no problems. It does not mean that there are no vision problems or there is problems maybe lying in wait. So sometimes seeing 6/6, especially if you're a boy and there's maybe a genetic predisposition in the family of being long-sighted, it does not mean that just reading letters of a chart means that you are okay. Now, let's start with firstly the risk factors. So if you have a family member, grandfather, father, that might be long-sighted, and that basically means that they might be wearing glasses like this. You can see my one eye is much larger than my other eye. Now, this is a typical hyperope prescription. It's a long-sighted prescription. It's a plus lens. And what does it mean? It means that your eyeball is either smaller than what it should be, or the cornea is flat. It looks something, instead of like following the normal curve, the cornea might be flatter than normal. And then the light focuses behind the orbit. So it means, in essence, that your focusing system, the internal eye muscle, this has to work all the time from the moment that your child wakes up. He needs to then focus into the distance where a normal person, an emmetrope we call it, when they look far away, this internal eye muscle relaxes. And why is this of critical importance? Now, if you've been on my YouTube channel, you know that I have talked extensively between the relationship between the internal focusing system, the internal eye muscle, and the external muscle, especially the medial rectus. So your brain has learned over periods of time that if it needs to focus, it's normally something that's looking close. It needs to focus light from close. So what happens if this internal eye muscle is having to work the whole time? This muscle that turns the eye in also has to work. So the two is linked. Now, with a normal person, if you are looking straight away, this muscle is relaxed And it means that this muscle is relaxed and both your eyes are now looking straight ahead, parallel, and there's no effort required. And this is the key word, is effort. Continuous effort with a hyperope. Now, if this internal eye muscle is activated, your child can, as I say, normally see like a hawk. He can see great far away. He goes to optometrist, no problem. But it doesn't mean that this eye muscle here is not working. It neither means that this muscle here is not being activated. So normally you find that if there's an imbalance, now, and this is precisely what happens, the eye is trying to focus because it needs to see clear, but it also needs to stay straight. So you have this what's going on? I'm focusing here to see clear in the distance, but this muscle now is trying to come in because this one is telling it I'm looking close, but this medial rectus here needs to stay straight to see far away. Now, very often you find that if you have an undiagnosed hyperopia, you'll end up being esophoria or an esotropia. Those type of children, as I said, most often boys, they very often also become slightly squint because of this imbalance in their vision. Now, what is the typical symptoms that you as a parent can look out for? Very simply, one, look at the genetic predisposition or risks. If there's somebody in the family, as I said, that's got to wear thick glasses, you need to have your child checked by age 6, preferably with an optometrist that uses a retinoscope. So a retinoscope, we've discussed this as well, is an objective measurement where the optometrist can actually detect any hidden hyperopia. The next thing you can also look at as a parent is that how is your child doing at school? Is there a balance between the effort that they are doing and the academic results? If there's an imbalance, again, maybe have their eyes checked, not just for a screening type of test, but a proper, thorough test, a binocular vision evaluation, because very often you also find then a binocular vision problem and binocular vision dysfunction. And binocular vision problems very often leads to this learning problems, ADHD, because your child is just having to struggle to read close. So you find that they might rub their eyes, tilt their head, they might even have balance problems. You might find that they're a little bit clumsy, the eye-hand coordination might not be good. All of these things is because simply there's an imbalance between the internal eye muscle and this medial rectus. And now the brain doesn't know, am I looking straight? What must I do with this eye muscle? Must I converge? What is going on? And you have this continuous effort. Now, like anything else, if you just go for a quick brisk walk or a jog, that's fine. But try to do that every single moment of the day. That's impossible. But very often, this is what your child is going through. And then, of course, the most important thing is that your child's ability to absorb information is compromised. So you have all of these factors which now starts coming into play. As your child grows older, very often you find there's coping mechanisms. So they might find that I don't want to read because it's effort. Their concentration is not so good. So they might very often be more outdoors. That's their happy place, is being outside, looking far away, behind a book, doing sustained looking close. That's certainly a lot of eye work for them. And with their visual systems, it's tremendously difficult. So undiagnosed hyperopia can directly lead to learning-related problems, binocular vision disorders. Really, it can actually ruin a child's life. You might find that the ability to do sport, eye-hand coordination is compromised. simply because their visual system is not working optimally. Their eyes aren't relaxing when they look far away and doing the normal amount of strain when they are looking close. And unfortunately, sometimes this can also basically show up in daughters or girls' eyes, where you find that they are short-sighted, a lot of them short-sighted, and their glasses are actually too strong. So they also might end up having problems with like rubbing their eyes, having tired eyes. So too strong glasses, undiagnosed hyperopia, where the full prescription isn't given so that the eyes can relax when they look far away, that can often lead to serious visual complications, unfortunately. Of course, I'm not even talking about the psychological effect of these things. So as a parent, what is one of the most important things that you can do to prevent your child being an undiagnosed hyperope, alternatively developing learning problems? There's always a balance. So my suggestion would be that if you do have a suspicion, then you just go and buy some reading glasses, over-the-counter reading glasses, and you put that over your child's eyes, and then you like stand 6 or 8 or 10 meters away, and check your own vision, and then see if your child can still see with that +1 reading glasses, which you normally give to people over 45. Now, if your child can still see that object good, it means simply that he's an undiagnosed hyperope. You need to take him to an optometrist for a full functional visual evaluation, and he might then need glasses, especially for reading, but he might need glasses for full-time wear as well. What I also tell my parents, if they have already developed some learning-related problems, and this is just coping mechanisms for your child, is swimming. Go and Google Michael Phelps, and you'll see what I'm talking about. But swimming, especially if you do it in a way where you have swimming lessons, structured swimming lessons, we find in our practice very often resolves most of the learning-related problems that your child might have developed. Anything from being cross-dominant to not concentrating. We find that structured swimming lessons is really highly effective, and it works extremely well for children that exhibit any types of learning-related problems, especially the boys. So most often in our practice, what we would do is we would do a basic eye examination, and if we do find undiagnosed hyperopia, we would give them their spectacles and of course visual therapy, but we would also advise the parents to consider taking their boy for a structured swimming lesson system so that your child can learn to concentrate and focus, and something happens in the water when it comes to your CSF fluid. I'm busy doing some research on that, but certainly we have found that our boys that go and swim, that does structured swimming, has a miraculous recovery and improvement when it comes to the ability to concentrate and read, especially if we do them the right glasses and visual therapy. So those are the 3 things that you can take away from today's video. Is firstly, just check if there's any type of genetic disposition, and if there is, make sure that you just buy some +1 reading glasses, put it on your child's eyes, let them look far away, and if they can still see with the +1, it is certainly an indication that they might be an undiagnosed hyperope. And then, go for a full eye examination at a functional optometrist where they can do retinoscopy, visual therapy, and then if you want to add on to that, consider doing some structured swimming lessons.